Hi, delighted to be joined today by John Wallace, a former head of resourcing at RBS, Tesco Bank and Barclays, author of the book Higher Power, and since January 2019, a director of Redford Residential Care, a 30-bed care home in Northern Ireland. Hi, John, how are you?
Yeah, I'm great, Mark. Thanks. How are you?
Very good, thank you. Very good. If it's okay, we'll get straight into it. I know you're tight for time today.
Yeah, thank you. Yeah, that'd be good.
So I suppose the first question, how does a former head of resourcing move from consultancy work in the Middle East to running a residential care home?
Well, the care home was founded by my mother back in 1987. Originally, it had 8 rooms, and then she expanded it up to 14 rooms not long after that. So it was a family business. Now, because of my mother's ill health towards the 2015, 2016, that's when I made the decision to leave the Middle East, leave the consultancy world, and come back and do a bit of looking after her and subsequently looking after my dad and taking on the business. And from that point, I made a decision that I wanted to expand the business. And we just finished, opened up 30 rooms to our full capacity back in January.
Okay. And I guess there won't be many people, I wouldn't have thought, who worked for RBS in 2008 during the bailout and found himself in the care home sector during the COVID crisis in 2020. Is there any comparisons that you can draw between the two experiences or the two events?
Yeah, I mean, that's a really interesting question, because I've actually thought about that. Lucky White Heather, follow my career. I think there's a couple of things that jump out at me in terms of organizational behavior, which I think have struck me. When I look back at my time in RBS, I don't think it's unkind to say that there was a very distinct culture within RBS, and a lot of that was a culture of fear that was driven by not wanting to call out bad decisions being made at the top. And I think that led RBS into quite a difficult place. Now, when I look at what's happening in the care sector, and particularly with the Department of Health, and dare I say the regulator in our industry, I almost see a very similar sort of culture, that I don't think great decisions have been made, but I think people have done things that will cover their back. And I can give an example. I've been banging on about testing in the care sector right from the start of this, and that's not because I have great foresight, but that's just because it's bloody obvious that if you test and understand where the virus is, you can control it in environments where there are vulnerable old people. Literally the first time that my staff got blanket tested was last week. And now this is after the day when Northern Ireland reported that there was one additional case of COVID-19 for the first time. So we're talking about the tail end. And that's so that Robin Swan, the health minister, can stand up and say, I've now tested everyone in all the care homes in Northern Ireland. But, as I would say, that's a day late and $1 short. Because the other thing is, we don't need one and done when it comes to testing. What we need is regular, systematic and frequent testing, so that as the manager of the home could say to me, do you know what, any of our staff could have picked that up as soon as they've done the test and they've got the virus now. Only if we test them on a weekly basis would we understand that we're completely clear and the capacity exists. And I think the way to safeguard the safety of the vulnerable people in the care sector is to have that regular testing for the staff in particular. It's quite a distressing process for the residents, but definitely test the staff. So to go back to your question, do I see any similarities? I think when you see how big organizations react in a crisis, where there is a reluctance to call out things that are going wrong or things that aren't pointing in the right direction, I think that can make a bad situation a lot worse.
When I was doing some of the research ahead of our chat today, I was actually surprised to read the kind of care home sector, certainly in Scotland, is dominated by SME type businesses. Again, in Scotland, 30% of the industry is made up of homes similar to yourself, where either the the business is one care home or it's one or two care homes.
Yeah.
I mean, what have been the financial and logistical challenges that you have had to overcome during this?
Yeah, and again, we're going to get some support with those. So, I mean, I should give credit where credit is due. The Department of Health, working with the regulator and the Trade Association, have come together a package to give us some financial support in that. It'll not be enough, but I mean that's fine. I mean the thing about, you know, when you run a business, you get the ebb and flow, and some days you make more money and some days you make less money. For us, the cost implication of this has been really quite significant. So, for example, we've tripled the number of cleaning shifts we have on. I also made a decision quite early on to increase the management presence in the home. So I've got 2 senior carers on at all time, and that comes with a cost. There's the obvious stuff about increasing the level of PPE. That's the protection equipment that we hear about so much in the news. And we've had to increase that. Now, again, to be fair to the Department of Health, they supply us with a lot of that free now. So there's a massive increase in the staff costs right across the piece. And also one of the things that we're very conscious of is we're not just in the business of keeping our residents alive. You know, there has to be a quality of life factor for that as well. And a massive part of that is their relatives come to visit and their relatives couldn't visit. So again, we made a very conscious decision to increase the level of activity that we had for the residents. We now put something on every afternoon, whether it's some crafts or a movie with popcorn, or we have a couple of the staff can play musical instruments and stuff like that, and we have a bit of a show and stuff like that. So again, that comes at a cost because you've got to increase the level of staffing for that as well. So there is, right across the piece, there is a pushing up of the costs involved. Now, as I say, the Department of Health have recognised that, and we'll see some compensation. And not to mention as well, of course, the reality that at one point in time, so we made a decision very early on. We increased the level of staffing in the business. We recruited about an extra dozen staff or so to take us up to 45, and that was very consciously done, because I reckoned that at some point in time we would be short-staffed because of people self-isolating. And indeed, about 3 or 4 weeks into the pandemic, we had 14 or so staff off 1 week on sick leave. Now, we also maintained a level of pay for them. It's not full level of pay, but we put compensation in to the pay. So all of these things, so when you have 14 staff off, a bunch of extra staff, extra cleaning, extra management, extra PPE, that really pushes sort of your prices. And of course, you've got to understand, we're in an industry where the cost of sales is everything is set by the government.
Yeah.
So you know, there's a limit to earnings.
Yeah.
It's been financially difficult, but the reality is all our tests came back negative. But it's worth it.
And so those changes that you made, the additional cleaning, the additional staff, was any of that mandated, or is that really down to the individual business owner to kind of look at the situation and take their own steps?
That's down to the individual business owner.
Right.
And you know, you'll have seen stuff in the media about some of them had staff literally camping on the premises and things like that. It's down to each individual business. We got an awful lot of guidance from the Department of Health, but again, without wanting to oversimplify it, it's, you know, wash your hands, keep door handles clean, and use PPE. You know, the basis of it's not complicated. It's how you choose to go about doing that is up to the individual owner. For us, we got handrails in all the corridors, of course, as all homes do. That's what I just saw. That's our issue. Get them clean all the time. The front door handle, every time somebody comes in, someone else is out, and we clean it again. We just got really paranoid about surfaces like that. And of course, washing hands. And we started taking the staff's temperatures every time they arrived. And we did all that really right at the start. I
read a Guardian article last Tuesday that said that almost a third of UK and half of the deaths in Scotland from COVID-19 have happened to residents of care homes.
Yeah.
And I guess I've heard lots about it in the press, but that really brought home the impact that this has had on the residents and obviously their families. Why do you think these numbers have been so high? And I guess the follow on from that, what do you think could and should have been done to prevent that from happening?
Yeah, I mean, I think I've got a pretty clear view on that, and I think that goes back to what was said about a culture of fear and not challenging assumptions that are made. So if you look back at the strategy, which was stay at home, protect the NHS, saves lives, that protect the NHS bit became an absolute mantra. So and what that meant was primary care for hospitals. We were very aware that actually they wanted to keep their ICU beds, their intensive care unit beds, for coronavirus cases. And what that meant, because all the testing was directed at hospitals, and because they were also trying to clear people out, is in reality what they ended up doing was taking people out of hospitals with COVID-19 and putting them into care homes. Now, that I don't think that was ever a deliberate thing. I don't think at any point in time someone said, right, here's someone with an infectious disease that attacks old people. Let's put them into a place where old people hang out. But that is, in effect, what happened. 17th of April was the first time we took, during the whole crisis, we took in, I think, six or seven people from NHS to come into the home, into a spare room in the home. And it wasn't until the 17th of April that the first person was tested before they came into our environment. So when we got some discharged from hospital, we were lucky. That was it. We were lucky. None of them had COVID-19, and we isolated them for 2 weeks and all that kind of stuff, which again, talking about quality of life, that's massively distressing for someone who is confused and going into a new environment and their family can't be there with them. And I think that bit's been a bit lost, as well as the genuine impact on some of these people. So there in a nutshell is the problem, is because the whole thing was about this protect the NHS. And I'm not saying that's a bad thing, but it was protect the NHS literally at the expense of the care industry. And you know what? I don't think it is the biggest leap in the world. So what can be done about it? I don't think it's the biggest leap in the world to make an assumption that if you have a respiratory illness that is lethal to the over 80s, which is where the vast majority of deaths in this happen, put your arms, put a ring fence around and security around the places where the over 80s are likely to be, and that's a care home.
Yeah,
you know, and that wasn't done. So it does irk me slightly when I hear government ministers of whatever flavour, whether it's the national government or the devolved administrations, they all say the same thing. We threw a protective ring around care homes right from the start. I'll tell you that is fundamentally not true. I have the letters from them at the start that basically said you have to take people that come out of the hospitals, and if they have coronavirus, we can't deal with them. You have to deal with it in your premises.